Let me find the right piece of paper here. Josephine, you may want to be in the session that Sandra Excellent is presenting. I mean, we would love to have you stay with us. If you prefer, Sandra Excellent is also presenting at the same time for the health and community care sector. So I'll defer to you to see where you want to spend your time. And seeing as the clock says 11:15, we're going to get started. If you wouldn't mind typing in the chat box, let us know what type of service you're with, just to give us a bit of information about who the faces are on the other side of the camera on the laptop. Thank you very much for joining us for PSHSA's Return to the Workplace Virtual Conference. My name is Tanya Morose, and I am the Manager of Prevention, Engagement, and Retention for the Public Safety Sector at PSHSA. I am pleased to welcome you to general guidance on occupational health and safety for businesses returning to the workplace, specific to the public safety sectors. My colleague Tim Metcalf will be delivering this presentation. Before we get started, I want to let you know, as we go through, as questions pop up, please put them in the chat box, and we will do our best with the time we have available to answer as many questions as we can, but we are going to hold questions till the end. I would like to introduce our featured speaker, Tim Metcalf. Tim brings over 30 years experience in the ambulance and fire services, specializing in occupational health and safety and infection prevention and control. Tim is currently a health and safety consultant for the public safety section at PSHSA. He is a Canadian registered safety professional and received the Queen's Diamond Jubilee Medal in 2013 for his involvement in occupational health and safety for emergency services workers. Our session will review the public safety sector-specific occupational health and safety guidelines, resources, hierarchy of control fundamentals, and highlight best practices with respect to COVID-19 infection prevention and control. Welcome, Tim.
Thank you, Tanya.
If you'd like to share your slide deck, Tim, and then we can start sharing what you've prepared for us.
Okay.
So as we're waiting for Tim to... There we go. Oh, you had it for a second there.
Oh.
So Tim, you can share your screen or you can share the PDF file there. That looks like it's coming. Yes, so put that in slideshow and we'll be good to go.
Welcome, everyone. Thank you very much for giving us this opportunity to speak to you today about the health and safety tools and equipment that we've pulled together. And specifically in this presentation, we're going to be speaking to a public safety sector. So police, fire, corrections, EMS, all of those people that are providing those emergency services and that emergency support within their communities and across the province. Excellent. So Public Services Health and Safety Association has created a significant resource center and compiled this center, sort of made it a one-stop shop. There's a lot of information out there on the web. You go on Google and you hit the, Mr. Google, Dr. Google, however you want to speak to it. And there's a lot of things out there. And we've sort of drilled down to the primary sites, Ministry of Labor, Education, Ministry of Health, Public Health Ontario. So the reputable sites providing the direction for people within the community and within the workforce. So we've created this resource, and it is on our website, easy to find. And I recommend to everyone to at some point go to this and have a look at all the different resources and links that we have. And we're constantly covering it. On that, we will be speaking specifically to the COVID guidance tools that we have created for this specific sector within the workforce. So we're going to speak about the hierarchy, and this is sort of the internal, well, it is the internal responsibility system. If anybody's taken certification training, you're very aware, you've probably seen this triangle before. But what we're looking at here is sort of the everybody's roles and responsibilities, and something to be aware of. Despite the fact that we've changed, we've had significant changes to how we interact with each other, where we go, what we do, how we are living our lives. All of the things that are in the Occupational Health and Safety Act with regards to the workplace and the regulations that also apply are still in effect. None of that has changed. So it's important to remember that. And so we're just going to do a quick review. When we look at the internal responsibility system, it's basically Bob is not responsible for health and safety. Everyone has a role. And it's sort of broken down by the employer, the supervisor, and the worker, and the health and safety reps. And that's just not our idea. That's what's in the legislation and how the legislation is built. The employer's responsibility, the employer builds the entire system, writes the operating guidelines, tells workers how to work safely, and what training and knowledge and safety equipment they need. Make sure the safety equipment's operating correctly. All the employer's responsibilities. The supervisor then make sure that the worker is following all those procedures and is a resource back to the worker when the worker isn't sure what direction to go in. If I never really used this piece of equipment, or I'm uncertain about doing a procedure I might have done for many years, but now in the new circumstances, it is the supervisor that they go back to get that information from, and is that resource for the worker. And of course, the worker is responsible under the legislation to follow what is written and follow those operating guidelines, use the equipment safely and not endanger themselves or any other workers. So in this, we're looking at a hierarchy of controls here. So a couple of different methods of controlling the hazards. We've got down the left-hand side, we've got ways that we can control the hazard from most effective all the way down to least effective. Still can be effective, but not as good as it could be ultimately if we just went to the top and eliminated. Elimination and substitution are ideal if we can do that. The problem with our current COVID-19 situation is we can't eliminate the hazard, and we can't substitute it for something else. We can't remove it and put the flu in instead, or something like that, or a common cold. No matter how much we'd like to. So those are kind of off the table at this point. So that leaves us with engineering controls. So building a better mousetrap, building a system, engineering, building something that keeps our workers safe. So you go to a store and you'll see a plastic screen between the cashier and the person, the customer. That would be an engineering control. An administrative control would be policies, procedures, how workers are working, and also very important and a very effective way of controlling hazards. And then finally, PPE, personal protective equipment. And in the emergency services, we rely heavily on PPE. The reason is, of course, we're in that infinitely variable workplace. It isn't a situation where you can go and engineer a control, because there is the station, the fire hall, the ambulance station, police station, all of those locations where we could put engineering controls in place. But then we receive calls down through 911. We attend at street corners, other people's homes, businesses, side of the road, wherever the call takes us. And you can't necessarily put an engineering control in place. So we rely very heavily on personal protective equipment. but it is in the hierarchy considered one of the lower at the lower end. When we look at race, race is just an acronym for looking at a way of managing a hazard. So recognizing what it is. So however it ends up on your radar, that's the recognized part. We want to do an assessment. How significant is that hazard to the worker? What kind of controls could we put into place? Whether it's and the controls being listed down the side there. Remember, we're limited to the bottom three in this circumstance, and then evaluate whether it's actually effective or not. And that's that's the final step of the recognize, assess, put controls in place, and then reevaluate to make sure that they are effective. So we have a number of resources, and this is just having a quick look at the resource, the landing place for the page. So we do have inspection checklists for Joint Health and Safety Committee, maintaining an effective health and safety committee during emergency during this emergency and other situations. All of those requirements for having a committee are still in place. Whether we do our meetings face-to-face or not, well, that can change. Performing the inspections, we still need to be making sure that the workplace is safe. And in reality, it's more important nowadays to make sure that the workplace is safe. So another piece that we've created is these guides, and the whole idea here is to provide guidance for workplaces and workers as to how to shift your workplace in this new reality that we're living in. So we do have community spread COVID, which means it's going from person to person. It's not just in hospitals like SARS was. This is in the community, so it got out of the box. How do we now modify our workplaces in order to manage that new situation? So you can see here we've created guides. We've got guides for 68 guides in total for various workplaces, specifically to public safety. We've got guidance for the employer, for fire services, office settings, as well as police. There isn't one for paramedic on our site yet, but I have spoken to a number of paramedic services, and what they've done is they've utilized the fire service. It's a very similar situation. It's crew members responding as well as being back in the station, and so there's lots of material that you can get from that, as well as worker guides, corrections, firefighters, paramedic, and police, all on our website and all accessible. So just quick points, the sort of thing that the employer should be thinking about when they're in their workplace. Protecting all of the workers, of course, is right at the very top. Having a system in place and controls in place to keep all of those workers safe. The physical distancing is a requirement in the workplace. It's an expectation. I was actually in a meeting with a Ministry of Labor, and they did mention that inspectors have been directed to ensure that if there aren't engineering controls in place and workers are closer than 2 meters, then that's something that they need to be under 25-2H giving direction. So basically, it'd be a compliance order to employers to get that happening. So if you can't put engineering controls in place, you'd probably be deferring to PPE, and administrative controls would be, of course, keeping people separated. But if people are in a vehicle, that becomes difficult. I know of one organization where they put one person in the back seat, one person in the front seat, and they put a shower curtain between the two. I don't know if that's a great idea because your rearview mirror is gone. If you can drive on mirrors, that's fine, I guess. But saying I couldn't see out the back window would not be a defense if something went sideways down the road. So those sort of things are what you'd be looking into. Environmental cleaning, disinfecting, reporting of illnesses, a number of these we'll be talking about. And of course, getting those policies out to people. Things are changing. we need to convey that message, and possibly that means training as well, and then tracking and monitoring your workforce, which is an important piece, especially in the emergency services. We'll speak about that more a little later on, as well as additional resources. As far as the workers, protecting themselves as well as coworkers, recognizing and assessing, putting controls into place, and whether that is administrative controls, which would be like physical distancing, that sort of thing. PPE would be wearing of the PPE. And hand hygiene is of utmost importance in today's environment, even if people are wearing gloves. So here we're looking at the public safety employer guide, and we'll start off with an administrative control, writing an infection control program, and having a designated officer program. As far as building on that, you would also have education response plan based on direction from the Ministry of Health, as well as Public Health Ontario, which have put out guides and directives, that tell emergency services what kind of PPE to wear in different environments, what level of PPE is required. Designated officer program is key for all emergency services, and it's been a requirement since 1994, was the initial directive from the Ministry of Health and long-term care. So the whole idea of having a designated officer in your workplace, it's that central person where if somebody has some sort of an exposure to an infectious disease, they can then contact that individual, and the designated officer can then direct them through the system, whether it's to the hospital for assessment, or whether it's follow up with public health unit, creating a mandatory blood testing act application, and forwarding that through the public health unit. It's a very critical component all of the time for emergency services, but during a time of pandemic, it is absolutely critical that we have somebody in that role, and the employees know how to get a hold of them. And they're 24/7, 365. It's not a Monday to Friday job. Sorry, leave a message at the tone on a Friday evening. We'll get back to you Monday morning when we're back at our desk. No, this is a 24/7, 365. And it is critical, especially, as I said, in these times. So I mentioned when an employee feels they have an exposure, there's also another side of it. When there's an exposure that has taken place, and public health is notified about it. So a public health unit then would contact the emergency service. Somebody comes up sick, they show up positive for it, let's say COVID-19. That information would then be given to public health. The public health unit would do what's called contact tracing, figure out who those people might have exposed. So they'll be looking at, well, how did they get to the hospital? Police, fire, EMS. Who do I call at the police service and the ambulance service and the fire service? The person is the designated officer. And that's, again, why it is so critical we have that role filled. The other side of it is the designated officer, when they receive that call from public health, they'll get a date and a time, possibly a name and date of birth of the individual. They need to have the ability to, one, look up whether their service responded to that particular call, right? So they have to have access to the database that way. They need to figure out who was staffing, right? So what are the staffing of that vehicle, whether it's a police car, ambulance, or fire truck, and then have a way of contacting those staff members after hours, because they might not be back on shift at the time you get the call from the public health unit. So all of those parts are the pieces about having an important designated officer program. And as I said before, I can't emphasize this enough. It's never been more important than it is right now. I'm going to carry on. Decontamination, cleaning protocols. So building those within your organization for vehicles, for the building, for personnel. So looking at all the different aspects of how we need to increase our current practices and where we need to increase our current practices. Physical distancing is another piece. staggering start times and reporting locations is something that a number of services have used, is spoken about in the guide, is where they've, for instance, fire departments and ambulance services, instead of having 3 or 4 crews responding to one location, they have them at different locations, perhaps a Parks and Rec building that isn't open yet, is where one of the ambulance crews is starting, or fire crew is starting their shift. Postponing any non-essential activity, training, using virtual environment, altering the layout and travel through a particular facility. And that could be, similar to what you see at the grocery store when you see the lines on the floor. It could be the a flow pattern where you come in one door and everybody exits another door, that sort of thing. And then required procedure masks when staff cannot maintain that 2 meter separation. Right? So if they are closer than 2 meters, what are we putting into place? And if we can't put an engineering control in place, then it needs to be PPE, and a number of services have moved in that direction. So looking at the same guide, but in this case, workers guide. So if you are symptomatic, it's not a time to go to work. So if you do have the COVID-19 symptoms, then stay home and phone that in and notify. Maybe there needs to be, depending on when your last shift was, contact tracing. All of these things need to be built into our policies and procedures. Active screening at the beginning of any time you're interacting with public, and this is already done with the ambulance service mandated by the Ministry of Health, and all of that information is on the website, and that can be utilized by your organization, that pre-screening before your workers interact with the public. Following donning and doffing protocols for COVID-19. And another resource we have on our website are posters. We have a complete set with police officers. We have a complete set for paramedics, as well as for the paramedic observer, which is a mandated requirement by the Ministry of Health, that there be an observer when a paramedic is performing their donning and doffing. So we do have checklists for that, and posters that can be printed, all free, all on our as resources back to the community. Cleaning of equipment and shared equipment, as well as personal issue equipment, cleaning of your workspace at the beginning, and that could be a cruiser. Definitely you'd want to think about keyboards, and then if you're into fire halls, dormitories, if somebody is using a CPAP machine. A CPAP is an aerosolizing generating machine. There's a concern of spread amongst staff members. So what can we do for separation with somebody like that? And absolutely stringent hand hygiene, ensuring that hands are being washed routinely, or alcohol hand rub. Not hot water, just warm water. We're just loosening things when we're washing our hands and rinsing them off our fingers. When you're using alcohol hand rub, that's when you're actually burning off the microorganisms, and that's why there's drying and cracking of fingers. So using moisturizers is so important for that hand care. But a must is anytime there's a safety concern of any kind, that needs to be brought forward to a supervisor. And of course, wearing your PPE is required by your employer for eye protection, as well as face protection is utmost importance. Another resource to look for, and we are one of the hosts of these, Section 21 guidance notes. The Ministry of Labor, actually, the Minister has the right to create, under the Occupational and Safety Act, committees that look at hazards that are specific to a particular sector. So there's a police Section 21 guidance, or Section 21 committee. There's a fire Section 21 committee, and the EMS Section 21 committee is actually a subcommittee of the healthcare Section 21 committee. So it has the power of the healthcare one, which is all your hospital, complex care, all the components of the healthcare system. So each of these create guidance notes. Each of these committees create guidance notes and there's different ways of accessing them. The police are through all police chiefs' bulletins, and there is it's ES guidance note number 8, and it is hosted on the Public Services Health and Safety Association website. So that's where you would go to find all of the guidance notes for the EMS section 21 committee. And the Fire Section 21 committee are now on the ontario.ca website. They've been moved over. 4-14 is the one you will be looking at for direction there. Now, there is a requirement for occupational illness reporting, and we have resources for that. So it is covered under the guide, the occupational illness requirement. But in the event the occupational illness requires reporting, we have checklists for that and numbers to that you can use to call. And COVID-19 is part of the reportables list back to public health. You probably wouldn't be part of that side of things. That's more around the testing of people and coming up with a positive. But if you did have somebody in your workplace who came up positive or tested positive for COVID-19 and had a significant exposure in the workplace, again, all part of your designated officer program and your infection prevention and control program within your organization, that would this is a resource that you can utilize in that situation. There's also a readiness assessment. It's a easy click. It's on our landing page again for all of this COVID information. With our guides, they're very high level about the with regards to the workplace and getting things rolling. The return to work readiness assessment, as well as the next slide, we're going to be talking about the roadmap, are much more specific procedures within your organization, and also resources to get things rolling as far as the planning and making things happen. So in the readiness assessment, there's 10 questions as far as your assessment, your ability to increase productivity in business operations. Maybe not productivity is the right word, but I guess it's productivity of the workforce. So it could be the same sort of thing. Managing staffing shortages. So if people are off sick, or we've got people that, let's say, for instance, are scared about coming to work, or because of that risk of having an exposure. So how do we manage our organization with those shortfalls in staffing? Implementing screening and tracking and reporting of our people. How do we disseminate information? What prevention measures are we putting in place? All of that sort of thing is part of this readiness assessment. So where are you at? It's an assessment of where you're at right now within your organization. And then the next step, of course, will be, what are we going to do about it? Before I come off this, though, there's one thing I do want to emphasize: supporting of workers' mental health. And there's no question, this is a significant change to the way we do business and the way we live our lives. And it has had an impact on people. There are people I know who have parents they've brought into their home because they want to keep them safe. They brought children into, the children are going to school, the children are socializing the same. And it's all about keeping everyone safe. And this is what we do for a living in the emergency services world, the public safety world. And there's nothing more important than our own family safety. So there's that. There's the impact that's going on at work, the pressures of the work. There are significant challenges for everybody. So it's important that we keep that in mind. Here we're looking at the roadmap document, another excellent document that again is on our landing page there. It basically breaks things down into 3 stages: our planning, then the implementation, and then operational. So in the planning, it's understanding legal requirements, public health measures, preparing the workforce, and then reviewing, developing policies, reviewing the policies we have in place, training procedures, all of that sort of thing. The next step in the implementation side of things are prioritizing the implementation of your control measures. Right? What are we going to do next? And then into our operational stages, going from that reacting, that sort of getting ready for that, I often refer to as the swimming for the surface, where people are, trying to get everything in place and ready to go. And then, okay, now we've got that happen, broken the surface. Let's look at what the future concerns are going to be and see if we can get ahead of that and be prepared for what's coming down the road. And you can see on the slide sort of a breakdown, the introduction there on the top left, and then on the right you can see how it actually breaks it down into like a checklist. And we've got the action items, considerations, who will be performing that, and timelines we're looking for, and then a check mark when you're done. So easy to use, and excellent resource at that point. Now, as far as your here, we're just coming to the end. So thinking about all the different things we've talked about, the different resources that are on the website. Here we're just sort of saying stop, start, continue. So what are things that you looking at your current practices that you might want to stop doing, right? It might be the way people are reporting to work. It might be the use of PPE. It might be whatever it happens to be. So what are we going to stop doing? And what are we going to start doing? All right? What's just twigged an idea and thought, geez, we really should get on that. So what are we going to start, and what are we going to continue and possibly augment down the road? But at this point, we're looking at sort of that, just give a thought to the material we've just talked about. What do we need to stop doing? What are we going to get going on? And what's working, and possibly we'll keep going. And that brings us to the end of our presentation.
All righty. Thank you very much, Tim, for sharing. And I appreciate the stop, start, continue. It's a bit of a way to reflect on lots of information that's coming at us and changing information. What are we doing well? Because I think there's a lot of good things happening in the public safety workplaces. And are there opportunities for improvement? Are there things that we can maybe tweak a little bit, or maybe we need to, it's something that hadn't even crossed our minds to think about doing. So thank you very much, Tim, for sharing. If you do have any questions, please put them in the chat box. And Tim, if you could stop sharing, please, that would be helpful.
Okay.
Thank you very much. Oh, I think I just forced you to stop sharing. All right. So, Tim, you have had the opportunity to speak to a lot of different public safety firms through conversations you've had with clients over the past few months when this has been our new reality. What are the themes that have emerged in your conversations? If you could speak to that in high level, broad strokes.
There we go. Sorry, I was just closing down my presentation. Can you still hear me okay?
Yep, we're good. What are the themes that
Perfect.
have emerged in the conversations you've had with clients during this time of COVID-19?
I see, well, this sort of information is invaluable to what they're looking for. Everybody is sort of at the point where we've known that there was always a possibility for this sort of thing to happen. And what are we going to do in the workplace? But people might not have thought to the extent that it has. And that's what I'm hearing a lot of. People are saying, okay, so I kind of thought the kids were going to be off school for 3 weeks instead of the March break. But it seems like now they're not going back to school till September. So how's that going to look? And how is it continuing in the workplace? And are these just short-term measures, or are we going to be implementing this over a long period of time? And I think that's something that people are coming to terms with is that this is, we don't know how long this is going to be carrying on for. And at this point, it is really important that we look at building, well, not building, but altering our current structure to accommodate our new reality, because it is our new reality right now, and we're not sure for how long. So I think it's important that we carry on.
Perfect. Thank you. Now, I know on the line, it looks like we've got 89 different people on the line now, from fire, police, there's some conservation. I saw some municipal emergency services on there. If anybody does have a question that you would like to ask Tim, please don't hesitate to put it in the chat bar. So a question from Heather, Tim, for you. Heather would like to know, what is the best messaging when we are still being flexible and things are changing on a consistent basis? That change is the constant.
Right. And that is the challenge of each workplace, pardon me. You would have to look into your organization and sort of build in a system where whether it's an email system and then everybody has to have access, or is it a paper system we're going to be using? So the dissemination of the information is critical. Uh, so it's going to depend on this is part of what you need to do within your organization is figure out how we're going to get that information out depending on what resources are available. As far as looking at current best practices, that's the whole idea behind these this website that we've created and all these different resources. We are keeping an eye on what's going on, and we can direct you to different sites and locations. So the return to work roadmap, for instance, I was talking about. The last 2 pages, or page and a half really, are just a listing of a whole host of different resources, and they're all links to various services, various organizations, and excellent place to start. So keeping an eye on that, and we are continually updating.
And I think if I can share one concrete example that came up from the I forget the name now, the Emergency Health Regulatory Authority branch, that sort of group, paramedics. The issue was in the initial stages, the COVID-19 case definition was changing daily. So if we printed it out, then it could be you were on shift yesterday and that was the case definition, but it changed overnight and this is the current case definition that we're using. So thinking about hard copy versus soft copy versus poster versus a screensaver and that sort of thing, because what might have been true yesterday's shift might not be current at the end of that shift or at the start of the next shift. Now, Natalie would like to know if there's been any consideration given to what the expectation is regarding personal protective equipment for practical training, like firearms or defensive tactics.
Okay, yes. Well, as I said, I was last Thursday in a Ministry of Labor. It was a Section 21 meeting, and the Ministry of Labor facilitator actually read out the guidance to Ministry of Labor inspectors saying all workers need to maintain at least 2 meters of separation. If you're within that 2 meter window, if there isn't an engineering control, a plastic shield, something like that, then the simple procedure masks are what people are expected to be wearing. And that provides a barrier. It's a barrier that prevents you from exhaling if you're into like a surgical procedure mask, but also it stops you from touching your face and other people touching your face, touching your nose, touching your mouth, all of that sort of thing, as well as and any sort of droplet that might become suspended in that cloth or material, similar to the curtains in between beds in a hospital room, semi-private room. You've got those curtains. They're privacy, but they're also there to sort of stop droplets, and they get captured in the material. They dry out, die. The virus will dry out, die. So that's the idea there. Use of force. That's an interesting question, because where you're actually doing the touching and contact, yet we're telling people not to physically touch and make contact. And I'm not sure, and that would be something I'd want to think about. And absolutely reach out to Tanya. We can sort of brainstorm ideas on that. I'm not sure I have an immediate answer. Tanya, do you have something?
Well, and I think that the challenge is recognizing the infinitely variable workplace. Well, sometimes we do want to have PPE on. It's the anticipation of what is potentially a dynamic situation. And right now, I can maintain that 2 meter distance, but is it possible that I might need to have to engage and go hands-on? Are we going to say, please stop 1 moment, let me don my risk perception need to factor into our concerns. So Bobby asked a good question about the route of exposure. Are we only concerned, Tim, about covering the mouth and nose with a simple procedure mask, or do we also need to worry about eye protection as well?
And yes, absolutely. And I'm sorry if I misled you there. Absolutely, eye protection is part of it. It's the mucous membranes in the eyes are a concern as well. So yes, it would be. And so eye protection as well.
So Natalie, you raised a good question about the mode of transmission, and I love all these questions, but I'm also conscious of the clock, and I don't want somebody to end halfway through a sentence. So if we need to continue the conversation, please reach out. We have a team of health and safety professionals that are supporting public safety. So we would be happy to have a conversation with you. Procedure masks versus N95. N95s are protecting you from aerosolized airborne particles. And unless you're intubating somebody in a hospital, for the most part, paramedic colleagues, yep, they will be doing some aerosol generating medical procedures, but